Hi everyone, we are here again with Dr. Laura, Naturopathic Doctor, for our third fertility segment. And this time we're going to talk about natural support for fertility and infertility. So Dr. Laura, what do we need to know?
So first, let's talk a little bit about, who is this affecting? And, you're not alone if you are struggling with infertility, but what is infertility? So loosely, infertility is if you try to conceive for about 12 months without success. Okay? So a lot of people throw that word around, but it's really important to understand the medical definition and if you fall into that category. And first and foremost, it is not an uncommon symptom or not an uncommon concern. The numbers are about 1 in 6 Canadian couples do experience some infertility.
Well, don't talk about it. So if you're in it, you think you're alone.
Absolutely.
And you think you're going to get pregnant right away. And that's just generally
It takes
not the case.
That is not the case. So understanding, having that education is really important. And first and foremost, working closely with your primary healthcare provider to sort of uncover maybe what's standing in your way, and if there's a underlying health condition that could be causing the infertility is a great place to firstly start.
Okay.
Wonderful. And then there are some other more natural things that you can do to help boost your fertility. What are some of the things that you recommend to your clients?
So, in general, we talked about in a previous video talking about getting the body prepared. So a lot of women simply can benefit from doing a detox. And that's a very mild form of just cleaning out the liver, the digestive system. Remember, that's where your hormones are recycled. So if there is any imbalance, a detox is a really great way to start. I like the herbal detox kit because it's simple, it's liquid, you can just add it in some water and focus.
And this one, I believe, couples with a really healthy diet.
That's right.
Diet. Yeah.
Everything is in that box pretty much, which is great, except your actual whole foods. But it's not stressful, and I think a lot of women can say, hey, I can commit to 12 days.
Yep. Wonderful.
Yeah.
Okay.
And are there a few other things that you would suggest as women go along this journey?
Absolutely. And a very important mineral that a lot of women are missing, infertility concerns or not, is magnesium. And I've really come to sort of scream this from the rooftops, but magnesium glycinate is a fantastic way to lower stress hormones, to actually help improve muscle function and muscle tone, and to promote a healthy pregnancy. So as little as 200 milligrams is all you need, but I love a single capsule format because it's simple.
It's easy.
Yes,
Just add it to your
and we've
regime.
talked about this in some of our other segments about de-stressing and taking one before you go to bed, and I've definitely incorporated it into my daily routine.
Great.
All right.
Last but not least,
the prenatal.
The prenatal. How much time do we have? So let's talk a little bit briefly about 2 factors that women should look out for when it comes to a quality prenatal. Number 1 is making sure that you're getting the proper form of folate or folic acid. There's an activated form, and on the label it will say methylfolate. Or 5-MTHF, and that's a long version of just the activated form of folic acid. Women need that, and that's the key ingredient of a prenatal, and you need to have it in high enough amounts. So making sure you read your labels, and if your prenatal does have that, then you know you're good to go. You're getting the amount that you need. And then most importantly is how many of your prenatals do you need to take? So, right?
Some of them have like so many in them, or just one a day, and you're like, how am I going to do this?
Please read the label. Some of the high quality ones,
guilty.
Yes, you should only require to take about 2 per day. It's hard to get everything in one tablet, I must say. But the higher quality versions do have it divided into 2 doses. And the higher quality versions do have those higher quality ingredients, less binders, less fillers. The last thing you want to do is find out that you're, activated or you're feeling nauseated because of the pill you're taking to help you get pregnant.
Yeah, and then you don't take it and it becomes a vicious cycle.
Yes.
Absolutely. Okay. Well, thank you once again, Dr. Laura, for some fabulous tips.